This is my Foley insertion video. I have verified the provider's order. I've gathered my supplies, my catheter kit, my sterile gloves, my assistant, and a flashlight. This is a sterile technique. I would knock on the door, introduce myself, verify the patient using 2 identifiers, last name, date of birth, and wristband. I would then educate the patient that the provider has ordered a catheter and why. Some of the reasons for a catheter include chronic renal failure, incontinence, or surgery. Ask the patient if they have any questions or concerns and if they are in agreement to the insertion of the catheter. I would also notify the patient about the risk for infection due to putting an inanimate object inside the body. Some signs and symptoms of infection would be increased urination, painful urination, discharge, possible fever. I would then clean the bedside table and raise the patient's bed. At this point, I would perform hand hygiene and apply gloves so that I can perform pericare prior to inserting the catheter. I would maintain the patient's dignity, but expose the patient so that I could provide the pericare. So that's all done. I've removed my gloves, perform hand hygiene again. Okay. And now I would open my kit. I do have these sterile gloves that are not in the kit because I don't fit the ones in the kit. So I'll place those to the side and we'll pretend like they were in the kit. So I'm gonna open my kit up, away from me first, then the sides, then towards me. I have a 1-inch border around the outside that I'm able to touch. I'm just gonna adjust this to make it appropriate. And then I will apply my sterile gloves. Again, I have a 1-inch border that I'm allowed to touch. I'm allowed to touch the cuff of the first glove, but not touch the outside of the glove. The second glove, I would scoop with my fingers, careful not to touch the cuff with my thumb, and apply this glove. At this point, I can adjust my gloves as needed. All right. I'm gonna get my tray ready here. I have a specimen cup in here, I have lube in here, and iodine sticks, which I will not be using on the mannequin, so I'll remove all of that to the trash. I will then lube my catheter and attach my syringe. Open my swab sticks. Maybe place them in my box. Throw that in the trash. I will now clean the penis. I will use my non-dominant hand to hold the shaft of the penis, and I will use my swab sticks in a circular motion. 1, trash, 2, trash, 3, trash. I will then oil my catheter in my hand. And place the catheter on my sterile drape here, like so. I would inform the patient that I'm going to insert the catheter. Once I see a flash of urine, I will go 2 inches further past that point. Hold firmly in place. And insert the saline into the balloon. I would give a slight shrug resistance just to make sure that the catheter is in place and not going to slide out. I would then attach the catheter to the leg, hang it below the bladder, on an immobile part of the bed. I would note any output that's in the bag, the color, the amount. I will then remove my sterile gloves, perform hand hygiene, I will then perform peri-care again. Okay, I'm going to ensure that my patient is comfortable. Lower the bed for safety. Make sure they have all of their provisions, including their call light. Another thing I would note is how the patient tolerated the procedure. I will then remove all of my trash, perform hand hygiene, thank the patient for their time, and exit the room to document. Oh, geez. Another important fact to note with catheter insertion, I would note the amount of saline that was in the syringe that I inserted into the balloon.